Namaste one and all. Today we are going to discuss about liver function test LFT. Welcome to our discussion on liver function tests, commonly known as LFTs. Today we are diving into a crucial aspect of medical diagnostics that plays a vital role in assessing liver health. The liver is one of the largest organs in our body, which is responsible for numerous essential functions, including detoxification, protein synthesis, and the production of biochemicals necessary for digestion. Liver function tests are a series of blood tests used to evaluate the health of your liver. These tests measure the level of various enzymes and proteins in your blood, including alanine amino transferase ALT, aspartate amino transferase AST, bilirubin, and albumin, among others. The results of these tests can provide valuable information about the condition of your liver, helping in the diagnosis of liver diseases such as hepatitis, cirrhosis, and liver cancer. In this video, we are not just going to talk about what these tests are. We will take a step further to guide you through the process of how these tests are conducted, specifically focusing on the correct procedure for blood sample collection. We'll also delve into interpreting the key results and understanding what normal and abnormal levels mean for your liver health. Whether you are a healthcare professional, a student, or simply someone interested in knowing more about liver health, this video is designed to provide you with a comprehensive overview of liver function tests. So, let's get started and learn more about how these tests work and what their results signify. In this segment, we will explore the critical first step in conducting liver function tests, the collection of a blood sample. This process is straightforward but requires attention to detail to ensure accuracy in the test results. Firstly, it's important to note that for LFTs, blood is typically collected in a red test tube. This red tube is specifically designed for serum tests like LFTs. The color coding helps laboratory technicians easily identify the type of test to be performed, ensuring that the sample is processed correctly. Now let's talk about the process of blood collection. The procedure begins with the healthcare professional cleansing the area, usually inside of your elbow, with an antiseptic wipe. This is followed by the application of a tourniquet here like this, something, okay, tourniquet, to make the veins more visible and accessible. Once a suitable vein is located, a sterile needle is inserted to draw the required amount of blood. After the blood is drawn, the needle is removed and a small bandage is placed over the puncture site. The process is quick and typically takes just a few minutes. But before you even reach this stage, there are preparation steps that you, as a patient, need to follow. Most importantly, liver function tests usually require you to fast for 8 to 12 hours before the blood draw. This means no food or drinks except for water should be consumed during this period. It's also advisable to avoid alcohol and certain medications that might affect the test results. But this should be done in consultation with your healthcare provider. It's crucial to follow these preparation steps accurately. They play a significant role in ensuring that your LFT results are reliable and provide an accurate reflection of your liver health. Remember, these tests are a snapshot of how your liver is functioning that specific moment, and any deviations from the preparation protocol can impact the results. Moving on to a specific aspect of the liver function tests, let's discuss the SGOT test. It's also known as AST, aspartate amino transferase. Understanding this test is crucial in evaluating liver health. AST is an enzyme found in various parts of our body, including the liver, heart, and muscles. The SGOT or AST test measures the level of this enzyme in your blood. It's a key indicator of liver cell health and integrity. Under normal conditions, AST levels in the blood are relatively low. However, if the liver is damaged or diseased, AST or SGOT can be released into the bloodstream, leading to an increase in its levels. Now, what do the numbers mean? The normal range for AST is typically under 40 units per milliliter, though this can vary slightly between laboratories. Specific ranges often fall between 12 to 38 units per liter. It's important to note that while AST is a critical marker for liver health, it's not exclusively liver specific. Elevations in AST levels can also occur due to issues in other organs like the heart or muscles. Therefore, interpreting SGOT or AST levels requires a comprehensive understanding and often needs to be correlated with other test results. For instance, comparing SGOT levels with ALT, another liver enzyme, compare the AST with ALT. This can help differentiate between various causes of liver damage. Maintaining AST levels within the normal range is indicative of a healthy liver function. However, elevated levels require further investigation. It could signal various conditions m- from mild liver inflammation to more severe damage like cirrhosis or hepatitis. In such cases, your healthcare provider will likely recommend additional tests or a detailed evaluation to understand the underlying cause. In summary, the SGOT or AST test is a fundamental component of liver function tests. It provides vital information about your liver's condition and, when interpreted correctly, can be a key tool in diagnosing liver related health issues. In this part of journey through liver function tests, we turn our attention to another crucial test, the SGPT, also known as ALT, alanine amino transferase. This test is a cornerstone in the assessment of liver health and provides essential insights into liver function. ALT is an enzyme primarily found in the liver. Unlike AST, which is present in multiple organs, ALT is mostly concentrated in the liver. This makes it a more specific indicator of liver health. The SGPT or ALT test measures the level of this enzyme in the blood. Under normal conditions, ALT levels are low. However, if the liver is damaged, such as by infection, inflammation, or injury, ALT can leak into the bloodstream, leading to an increase in its levels. So, what do the test results mean? Generally, the normal range for ALT is under 40 units per milliliter. But like AST, this can slightly vary. Specific ranges are often between 7 to 41 units per liter. Elevated levels of ALT in the blood can be a sign of liver damage or dysfunction. This could be due to various reasons such as viral hepatitis, fatty liver disease, or other forms of liver injury. It's important to understand that while an elevated ALT level suggests liver damage, it doesn't specifically pinpoint the cause. It acts as a red flag indicating that further investigation is needed to determine the exact nature of the liver problem. Also, it's worth noting that ALT levels can fluctuate, and a single elevated result doesn't necessarily indicate a chronic liver condition. Your healthcare provider may recommend repeat testing or additional diagnostic procedures to get a clearer picture. In summary, the SGPT or ALT test plays a pivotal role in evaluating liver health. It is particularly valuable because of its specificity to the liver. Understanding the results of this test, especially in conjunction with other LFTs, can provide critical insights into the state of your liver and guide appropriate medical care. Now let's delve into an important component of liver function tests, bilirubin. Understanding bilirubin and its different forms is key to comprehending liver health and function. Bilirubin is a yellow compound that occurs in the body during the normal breakdown of RBC, red blood cells. It travels to the liver where it's processed and eventually excreted in bile. Let me repeat, bilirubin is a yellow compound that occurs in the body during the normal breakdown of red blood cells. It travels into the liver where it's processed and eventually excreted in bile. In the context of liver function, we often discuss two types of bilirubin, total and direct. Total bilirubin is a measure of all the bilirubin in the blood, including both unconjugated, that is indirect, and conjugated, which is direct forms. Unconjugated and conjugated forms, or they can also be called as indirect and direct forms. Normal levels typically range from zero point 0.3 to 1.3 milligrams per deciliter. On the other hand, direct bilirubin, which is bilirubin that has been processed by the liver. Direct bilirubin is the bilirubin which is directly processed by the liver and is ready to be excreted. Usually has levels from zero point 0.1 to zero point 0.4 milligrams per deciliter. The distinction between total and direct bilirubin is significant because it helps in diagnosing different types of liver and bile duct disorders. Elevated levels of total bilirubin can indicate a variety of conditions ranging from hemolysis, which is excessive breakdown of RBC, to liver diseases that impair the liver's ability to process bilirubin. On the other hand, if direct bilirubin is high, it suggests that the liver is processing bilirubin properly. But there might be a blockage in the bile ducts preventing its excretion. This could be due to gallstones, tumors, or inflammation of the bile ducts. Abnormal levels of bilirubin, whether high or low, can also lead to jaundice, a condition where the skin and whites of the eyes turn yellow. Jaundice itself is a symptom, it's not a disease, and indicates an underlying issue with the liver function or red blood cell breakdown. In summary, bilirubin levels, both total and direct, provide critical insights into liver function and health. Elevated or abnormal levels can be indicative of various health issues that may require further investigation. Understanding these levels in conjunction with other LFT results is essential in diagnosing and managing liver related conditions. In this segment, we will explore the significance of serum total protein and albumin in liver function and what deviations from their normal ranges might indicate. Let's start with serum total protein, which encompasses all the proteins present in the blood, including albumin and globulins. It's a normal range to have in between 6.7 to 8.6 grams per deciliter. Serum total protein levels are a reflection of the liver's ability to synthesize proteins, which is crucial liver function. Proteins are vital for various body processes, including maintaining oncotic pressure, immune response, and nutrient transport. Serum total protein levels are a reflection of the liver's ability to synthesize the proteins, which is a crucial liver function. Proteins are vital for various body processes, including maintaining the oncotic pressure, immune response, and nutrient transport. Okay. Deviations from the normal range of serum total protein can be indicative of various conditions. Low levels, for instance, might suggest liver damage or disease, as this could impair the liver's ability to produce proteins. It might also indicate other health issues like malnutrition or kidney disease, which can reduce protein levels. High levels of total protein might be seen in conditions like dehydration or chronic inflammatory or infectious diseases, which lead to increased production or decreased clearance of proteins. Let me repeat, high levels of serum total protein might be seen in conditions like dehydration or chronic inflammatory or infectious diseases, which lead to increased production or decreased clearance of proteins. Let's move to the albumin. It is the most important abundant protein in the blood plasma, accounting for about 60% of the total protein produced exclusively by the liver. Albumin helps maintain blood volume and pressure by drawing water into the bloodstream. Okay, let me repeat this concept. Albumin protein is found in the blood plasma and it is accounting for about 60% of the total protein, 61.1 if you see maximum value. Produced exclusively by the liver, albumin helps maintain blood volume and pressure, blood volume, as well as the blood pressure. How it does this? By drawing the water into the bloodstream. It will draw the water into the bloodstream. The normal range for serum albumin is between 3.5 to 5.5 grams per deciliter. Low levels of albumin, known as hypoalbuminemia, can be a red flag for liver disorders like cirrhosis or chronic hepatitis, as these conditions can hinder the liver's ability to synthesize albumin. Hypoalbuminemia can also result from kidney disease, malnutrition, or inflammation. Elevated albumin levels are less common but can occur due to conditions like dehydration. In summary, serum total protein and albumin are integral to understanding liver function. They provide insights into the liver's synthetic capability and overall health. Abnormal levels of these proteins require further investigation to pinpoint the underlying cause, be it liver related or otherwise. Understanding these parameters is crucial for a comprehensive evaluation of liver function and guiding appropriate medical interventions. In this part of our discussion, we focus on serum alkaline phosphatase, commonly referred to as SALP, and its role in diagnosing liver diseases, particularly across different age groups. SALP, SALP is an enzyme found in several tissues throughout the body, with the highest concentrations in the liver, bones, kidneys, and the digestive system. In the context of liver function tests, the measurement of SALP is crucial because elevated levels of this enzyme can be a sign of liver damage or disease. The normal range for SALP in adults is typically between 30 to 120 units per liter. However, it's important to recognize that these values can vary based on age. For instance, in children and adolescents, the range is broader and can go up to 350 units per liter. This difference is due to the higher bone growth rate in younger individuals, as SALP is also released during bone formation, When assessing liver health, elevated levels of SALP in adults can indicate a variety of liver conditions such as bile duct obstruction, cirrhosis, or hepatitis. It's a particularly sensitive in detecting diseases related to bile ducts, as SLP levels can rise significantly when these ducts are blocked or damaged. In children, interpreting SLP levels requires careful consideration due to their higher normal range. A significant elevation beyond the expected range for their age can suggest liver issues, but it could also be related to rapid bone growth or other non-liver related factors. Thus, while SALP is a valuable marker in liver function tests, its levels must be interpreted in the context of the patient's age, overall health, and correlating with other test results. Elevated SALP levels are not diagnostic on their own but can prompt further investigation to identify the underlying cause of liver dysfunction or disease. In this section, we will discuss the gamma glutamyl transferase test, commonly known as GGT, and its critical role in diagnosing liver and bile duct disorders. GGT, gamma glutamyl transferase, is an enzyme that plays a key role in the metabolism of glutathione, glutathione and is present in many tissues of the body, with the highest concentrations found in the liver and bile ducts. The GGT test measures the level of this enzyme in the blood. It's a sensitive indicator of liver damage, particularly damage related to the bile ducts. The normal range for GGT is generally considered to be 0 to 40 units per liter, although this can vary slightly depending on the laboratory. Elevated levels of GGT are often one of the first signs of liver distress, especially in conditions that cause bile duct obstruction, such as gallstones or tumors in the bile duct. One of the key reasons why the GGT test is so valuable in diagnosing liver and bile duct disorders is its sensitivity to biliary obstruction. Even minor blockages can lead to significant increases in GGT levels. Additionally, GGT levels can be elevated in cases of liver inflammation, hepatitis, and cirrhosis, making it a useful marker in a wide range of liver conditions. It's important to note, however, that elevated GGT levels are not specific to liver disease alone. They can also be influenced by other factors such as alcohol consumption, certain medications, and other medical conditions. Therefore, an elevated GGT level is often assessed alongside other liver function tests to gain a more comprehensive understanding of liver health. In summary, the gamma glutamyl transferase test is an important tool in the diagnosis of liver and bile duct disorders. Its sensitivity to changes in the liver and bile ducts makes it a valuable indicator, helping to guide further diagnostic testing and treatment plans. Understanding the GGT levels in the context of other liver function test results is crucial for an accurate assessment of liver health. As we conclude this overview of liver function tests, let's recap the key points. We have explored various tests, including SGOT or AST, SGPT or ALT, total and direct bilirubin, serum total protein, serum albumin, serum alkaline phosphatase for both adults and children, and gamma glutamyl transferase, Each of these tests provides vital insights into the health and function of the liver, an organ crucial to numerous metabolic processes in the body. The importance of LFTs lies in their ability to detect early signs of liver damage or disease, guiding them timely intervention and management. The normal ranges we discussed serve as benchmarks for evaluating liver function, but it's important to remember that these values can vary slightly based on factors like the testing method and the individual laboratory standards. If you are undergoing these tests or interpreting their results, remember that variations from the normal range may necessitate further evaluation. It's essential to conduct healthcare professionals for a detailed interpretation of these results and understand their implications in the context of your overall health. Liver health is pivotal to our well being, and understanding these tests is a step forward in maintaining it. If you have questions or concerns about your liver function or health, I encourage you to seek advice from a medical professional. We also provide certain consultations from our clinic. They can provide personalized guidance and recommendations based on your individual health needs. Thank you for joining me in this comprehensive look at liver function tests. Remember, staying informed about your health is key to maintaining it. Take care and stay healthy. I invite you to reach out to Brahmi Ayurveda Clinic located in Chikmagalur, Karnataka, India for personalized Ayurveda and advanced herbal therapies, especially tailored for balancing liver issues. Our team at Brahmi Ayurveda Clinic is dedicated to providing holistic and effective treatments that align with the ancient wisdom of Ayurveda and several herbal therapies. For more information, insights, and updates on Ayurveda treatments, don't forget to subscribe to our website vedavidya.com and our YouTube channel. We regularly update both platforms with valuable content related to Ayurveda and holistic wellness. Your queries and discussions are important to us. Feel free to ask your questions or share your thoughts in the comments section below. We are here to guide you on your journey to optimal health and wellness. Thank you for watching, and we look forward to connecting with you at Brahmi Ayurveda Clinic. Stay healthy and in harmony with nature. Thank you.